Glad to have you on board, Dr. Jones.
Very nice to be
Heard
here.
so much about you and your track record. You're a maverick, man. That's very good. Great to have you on board.
Thank you.
Dr. Jones, you're not only a practicing physician, but also an entrepreneur in the healthcare space. Can you tell us about your journey from medical school to developing innovative disinfectant systems?
Sure. I'd like to back up just a little bit. When I was a little kid, my mother's a nurse, and she got me this stethoscope set, a little doctor set. And I would go around listening to everyone's heart and putting Band-Aids on people and everything. And, we have some pictures of me doing that. And I realized that when I was younger, I just wanted to help people. I wanted to heal people. That was my whole concept. And then I discovered Leonardo da Vinci, and I started kind of studying his perspective of having balance in life, being able to draw and to paint and to write and to sketch and to be involved with medicine. And there was a time and place where you could be a master of the world and actually have an understanding of everything that there was out there. And what I did was I tried to direct my life towards that goal. I wrote, did some poetry, did some artwork, and kind of got into comic books and collectibles and things. And when I became a doctor, I vowed that I would continue to have that balance in my life. And unfortunately, medicine, which is kind of leading me to the entrepreneurial level in my life, has taken a deep dive in regard to the patient relationship and the time that doctors can actually spend with their patients in that healing role. And to the point in which I want to practice less and less, and have looked at ways that I could be an entrepreneur and be able to have a financial, have financial stability without being a physician. And it's kind of sad. But the point is that healthcare is broken, and it's made me a very angry person, which I don't like to be. So I'm directing that towards actually trying to fix healthcare. And my involvement with the FPC has been tremendous to do that. And being an entrepreneur, looking for innovative ways to actually fix things without having to just rip it down and leave no solution after the walls have been broken. That's why I'm here today.
Brilliant.
I appreciate that.
Brilliant. I'm really impressed.
Thank you.
So your work spans from emergency medicine to infection control, if I understand right. So how has this diverse experience shaped your views on healthcare reform?
Sure. I think to back up a bit, I did internal medicine in pediatrics, and that was basically a primary care focus. And when I first went into that, I thought that would be great. I'll work in the clinic. Maybe I'll do some hospital work. And I realized, quite frankly, that primary care doctors don't make any money. The system's designed to prevent folks from wanting to do preventative care and primary care, to the point in which the majority of the work that I do is now emergency medicine, especially in rural places and rural sites. In regard to developing things towards infection control, at the beginning of the pandemic, people were getting sick, going into a patient room, and then housekeeping folks, EVS, would come in and disinfect the room. And I was the chief medical officer at the time, and they said, why are people getting sick after they have had COVID? We clean the room, someone comes in, next patient comes in, and they get sick. And I said, I have no idea what the hell you're talking about. I have no knowledge of disinfection and cleaning. And so I started studying and evaluating it, and it was very horrific to discover that the majority of the chemicals that are out there in the world are not only ineffective and don't kill the bugs that are, especially in the hospital arena, rampant and being spread from patient to patient, but they're also more harmful than the diseases that the patients actually have.
Amazing.
So that prompted me to decide to, again, in an entrepreneurial fashion, to eradicate my company. And my goal is kind of a small goal. I just want to change the entire world in regard to sanitation and disinfection and cleaning by replacing every single chemical with the green, eco-friendly chemicals that we have discovered.
So you want to be the global Mr. Clean?
Global Mr. Clean, but I'd like to keep my hair. I think I would like to do that if that's at all possible. I look at patients and I look at the systems and the things that they have to deal with. And healthcare is a nightmare right now. People come into the emergency room. They're moved through as quickly as they possibly can be. They have limited interaction with their providers. They have limited caring and empathy. And then they go into the emergency room seeking things because they feel they have to have some restitution for their pain and for their suffering. So they'll look for opiate medication. When they don't get it, they get angry. Physicians feel that they need to give those opiates out to those patients in order to get them to be happy. And then you have patients that are really sick, but you don't have the time or the effort to put into them, or you have to move them through the system because of the corporate structure that exists. So it's very disheartening.
So you think the lowest hanging fruit is to do it within the system or outside the system?
So
These goals you're talking about.
I think on an individual basis, individual physicians need to basically push back against these corporate run
Yeah,
systems where they're told how to act
but
and
they're
told to
not
do
going to push
unethical
back
things.
because they're afraid of losing their jobs.
Exactly. And the higher up you get in those systems, you have golden handcuffs and you're told to keep everyone in
Less
line.
likely, even.
Much less likely. So the low-hanging fruit is individual docs that do really want to make a change, even in their individual day-to-day. Like I've told large corporations that want to hire me, to go to hell. And I've told them, I would only work for you if, you ended up running a drive-through, at Burger King versus Wendy's, because I
Yeah,
actually like Wendy's. So the point here is that individuals can make a difference by saying no. They probably won't. So the real fruit to actually grab is destroying these large corporations. And how do you destroy them? By creating alternatives. Small hospitals aligning with local entrepreneurs and local businesses, infusing specialty care in at the local level, the rural level, keeping small hospitals open, keeping small systems open, and pulling things away from these large conglomerate healthcare systems, which are heavy at lobbying the government for change.
Very interesting. So, in a fully deregulated healthcare market, how could we ensure ethical practices and patient safety without stifling innovation?
Sure. So that's a very difficult question to answer, to be truthful, because the balance between transparency and HIPAA, or the patient protective
Yeah,
mechanisms that are out there, is a seesaw that a lot of hospital systems will play. So they will determine not to release information, let's say, we'll talk about this in a little bit, healthcare associated infections and healthcare associated conditions, in order to avoid fines from the government that actually would cause them financial detriment. So transparency is a huge part of that deregulation.
indeed.
The opportunity also comes with risks, because if you're deregulating a system and allowing open transparency, how do you maintain that data and not have it be sold to insurance companies or misused, patients not being allowed to get care because they have too many diagnoses? One of the things that has been postulated, which I think has some merit, is sort of a blockchain system where you'd have definitive maintenance of security of those systems. But again, the idea is who has the piety and the perspective to be in control of those systems without leading those systems into further deficit, and
Yeah,
that's challenging. Then, as far as the whole, how do you create systems? You base it on merit and actual outcomes, rather than, as has been said recently, just pay for performance. So you have these blockchain systems set up, and then patients operate through the system, and then at the end of the day, the physician or the entity gets paid based on outcomes, not based on how much time they spent with the patient or didn't spend with the patient, or how much they documented in the chart. It's actually based on patient outcomes, increasing longevity, increasing health, and also increasing good palliative care at the end of life.
interesting. So, what radical changes to healthcare financing could simultaneously reduce costs, improve outcomes, and preserve individual choice?
Sure. There's a model that talks about having kind of a healthcare savings account, whereby a patient would be either rewarded or penalized as far as how much they actually take out of that account.
Hmm.
That has merit, and that needs to be looked at. Obviously, regulation would have to change in order to support such a mechanism. And another downside of that system is that patients that have genetic diseases and have a variety of different illnesses may be penalized inappropriately because they're draining or taking too much out of that healthcare savings account. There's also the concept of having kind of like an X game, sort of a system where you have innovation be rewarded financially. And from the standpoint of providers, they can create the tools that they need to actually use by having a reward system for innovation, as opposed to having a reward system just for ordering a whole number of tests to benefit the corporate system within which they work. So that kind of X game system could be that based on reward for actual innovation that leads to good outcomes.
Makes a lot of sense. So, how can we apply your innovations in disinfectant systems to create a new paradigm for preventing healthcare associated infections?
Great question. So, interestingly enough, if you take a step back, as far as healthcare associated infections or conditions, a healthcare associated condition is, let's say you go in for a hip replacement,
Yeah.
and then you get a healthcare associated infection, you get Staph aureus in your hip, and then you have to have a hip spacer and you can't walk for 6 months and you're in the hospital for 2 months because of that infection. That's a healthcare associated condition.
Yeah.
Okay. That could be avoided by better sanitation. How does better sanitation occur? Well, it occurs by using chemicals. It's all about the chemistry. Chemicals that allow you to have a low or short dwell time with a broad spectrum kill with no residue that actually leads to life-saving changes. That simplistic concept could decrease healthcare associated conditions dramatically.
Yeah.
The challenge is people don't want to even look at that because they're in with these large corporate entities that they've been in with for several years. They're locked in 5-6 year contracts. There are GPOs that exist, especially for hospitals, which penalize hospitals for buying outside of a GPO. And the GPOs don't want to let an innovative system like my system in because it actually hits them in the pocket for the feedback they're getting from these large corporations. So again, changing policy to say that by X year, all hospitals need to have true green eco-friendly systems, not just ones that the EPA has sanctioned as green enough, but truly systems that don't leave residue or cause harm or detriment to patients. They have to be water safe and food safe chemistries. There's only a few chemicals in the world that actually kind of equate to that.
Yeah.
I'm fortunate enough to have, partnered with an agriculturalist and a brilliant fellow who introduced me to an agricultural product that we imported over into medicine, and that's what we're working on now. The other piece is to actually increase the knowledge base and increase the import placed on environmental service workers to create with these systems the knowledge to say, hey, it's about the dwell time. You have to leave the chemical on for X amount of time, and then assure that there's no residue left behind, because that residue actually is a nidus for infection, for growth of various different organisms. A lot of the multi-drug resistant bugs that we have are a result of growth in those mediums that are left behind by those sticky residues left by other chemicals.
Yeah.
And those simplistic concepts go all the way back to the ancient Greek folks who cleaned with vinegar and our own bodies where we get rid of things with hydrogen peroxide. So the concept of oxidative destruction goes back thousands of years, and probably back to creation, because that's how our cells stay alive. I think that when you look at all of those things and put them into a pocket, it's very complex for people to think about making a change that is a systemic change, but those systemic changes can save dramatic numbers of lives.
Fantastic.
1 in 31 patients that goes into a hospital, again, expects to leave without having a disease that they didn't bring to the table to begin with, and they get a healthcare associated infection. When you look at that and then you say, okay, so the majority of the chemicals that are out there have long dwell times, 4 to 10 minutes, in order to kill all the bugs that need to be killed. And then again, they leave a residue that allows for bacteria, viruses, and fungi to grow. So in the time it takes for other chemistries, like the one that we've developed, to kill all those organisms in and around a minute, with some exceptions that are under 4 minutes. Now that allows for, you leave that substance on for a very short amount of time, and when it evaporates, there's nothing left to harm anyone. The other thing about those residues too is that those residues do lead to asthma, cancers. We anticipate that if the world embraced what we're doing, we would dramatically decrease cancer rates, especially among healthcare workers, environmental service workers who get bladder cancers, all kinds of different respiratory illnesses, etc. So the EPA won the battle against hard surface disinfection some years back. The FDA holds the patent or holds the control to say a chemical can or cannot be used to clean a device that either goes into a body or broaches that basically the mucous membranes and actually is exposed to the bloodstream. Our chemical does actually disinfect to the level to consider it a sanitizer. It's not debatable. However, each individual object, whether it be a heart valve, whether it be a medical device used to help somebody in a respiratory sense, each individual device, in order to be able to be used to disinfect it, has to go through FDA certification. Mm-hmm. And it also has to be made at an FDA certified plant. All these regulations mire the whole concept up to the point in which the United States has set it up so that they can't have an adequate way of disinfecting devices and disinfecting tools. And that's why we're working with other countries. We're working with the country of Africa and South America, where they're open-minded more to be able to accept these changes.
So tell me about FPC. You recently joined the board of directors of FPC.
Yes.
We're glad to have you on board. So how do you think this would help you in your business, in your goals, in your ambitions, and how can you work closer with FPC?
It's great. Thank you. Yeah, I think one of the things, Ziad, and I really appreciate the fact that you invited me to be part of this, is that we have a parallel thought process, you and I. You get very pissed, and so do I, when stupid things prevent you from making change that will help people. It's very, very, it angers me to no end. I'll like stay awake all night just being so effing pissed off that I can't fix things because of a regulation or because of something that's blocked by a lobbying body that prevents things from improving someone's life.
Right on the money.
And so that's why I was so interested in partnering with you folks and to be actual part of the ability to say, if we collect a number of folks together that are smart enough to realize from being in the trenches as well as being in leadership roles, that there are things that we need to change, and we need to change them at the governmental level, at the policy level, in order to allow for all these things to occur. That's what's most amazing about working with you and working with the FPC, and that's what I'm excited about. Really, I don't think that we can move forward with the things that I've tried to do unless policies will allow for us to bypass some of these age-old and dry and stale regulations that don't allow for real change.
Brilliant. You are a great asset to FPC.
Thank you.
We're going to be here for a long time and piss off a lot of people in a good way.
I hope so, yes.
Thank you so much.
Thank you.
Time.
Thank you.
Thank you, Martin.